The process of becoming a licensed medical practitioner in Australia for an MBBS graduate from India involves several steps, including exams conducted by the Australian Medical Council, or AMC. Here's a detailed breakdown of each step, covering costs, exam patterns, duration, scope, and salary prospects. 1. Eligibility and Self-Assessment. The requirement is a valid MBBS degree from a recognized university. The process involves verifying your medical qualifications through the AMC portal. You'll also need to self-assess your eligibility via the AMC website, especially if your degree is from a country outside Australia. 2. Create an AMC portfolio. On the AMC portal, you need to register and create an AMC portfolio, which involves filling out your personal details, education history, and qualifications. The cost for the registration fee for the AMC portal is $510 Australian, which is non-refundable. The registration is done online, and it typically takes a few days for your account to be active. 3. AMC Exam Pathways. There are two primary pathways for foreign medical graduates. The first is the standard pathway, which is most common for graduates from India. The second is the competent authority pathway, for those who have already passed exams such as USMLE, PLAB, etc. The standard pathway includes two exams, the AMC MCQ, which is multiple choice questions, and the AMC clinical exam. The AMC MCQ exam is designed to assess your knowledge of basic and clinical sciences at a level equivalent to an Australian medical graduate. The exam consists of 150 multiple-choice questions covering general medicine, surgery, pediatrics, psychiatry, obstetrics and gynecology, and more. The questions are of the single best answer type. The cost for this exam is 2,920 Australian dollars. The duration of the exam is 3.5 hours. You can take the MCQ exam at various centers worldwide, including some in India. Typically, you will receive your results within 4 to 6 weeks. For study resources, you can refer to the AMC Handbook, Murtaugh's General Practice, and online practice questions and mock tests. The AMC clinical exam is intended to assess your clinical skills, problem-solving abilities, and professional attitudes. The format includes 16 stations, each focusing on a particular clinical scenario. These stations are designed to test your skills in history-taking, physical examination, communication, and diagnosis. The cost of the clinical exam is 3,700 Australian dollars. The clinical exam is conducted over 1 day, with each station lasting around 10 minutes. This exam is held in Australia, and unfortunately there is no online option available. It may take 8 to 12 weeks to receive your results. After clearing both the AMC MCQ and clinical exams, you must apply for provisional registration with the Medical Board of Australia. The registration fees range from $835 to $1,400 Australian dollars, depending on the type and level of registration. Provisional registration is usually granted for 1 to 2 years. Supervised practice or internship. Before obtaining general registration, you are required to undergo 12 months of supervised practice in an approved Australian healthcare setting. You will be placed in a hospital or clinic under supervision, where you will be observed and assessed. Interns earn between 65,000 to 75,000 Australian dollars per year. There are no additional costs for the internship itself, but you will need to meet living expenses. General registration. After completing your supervised practice, you can apply for general registration with the Medical Board of Australia. The registration fee is approximately $835 to $1,400 Australian dollars. The general registration process can take 4 to 6 weeks. Permanent residency, which is optional. If you wish to settle in Australia after gaining general registration, you can apply for permanent residency under the Skilled Migration Program. Exam timeline overview. For the AMC MCQ exam, you should prepare for 3 to 6 months. The AMC clinical exam requires a bit more time, typically 4 to 8 months of preparation. In total, the complete AMC process usually takes about 1.5 to 2 years. This, of course, depends on your preparation and the exam schedules. Cost overview. Creating your AMC portfolio will cost around 510 Australian dollars. The AMC MCQ exam fee is 2,920 Australian dollars. For the AMC clinical exam, you will need 3,700 Australian dollars. Provisional registration can range from 835 to 1,400 Australian dollars. So, the total estimated cost is between 8,000 and 10,000 Australian dollars. Keep in mind, this does not include living and travel expenses for the clinical exam in Australia. Once you clear the exams and complete the internship, you can work as a doctor in Australia. The demand for doctors, especially in rural and regional areas, is quite high. You can further pursue specialization in areas like surgery, internal medicine, emergency medicine, and more, through the Royal Australasian College of Physicians or other professional bodies. Interns can expect to earn between 65,000 to 75,000 Australian dollars per year. General practitioners usually earn between 100,000 to 150,000 Australian dollars per year, depending on location and experience. Specialists in fields like cardiology, neurology, or surgery can earn between 200,000 to 400,000 Australian dollars per year. Let's summarize the key points. First, eligibility. You need an MBBS degree from a recognized university. For the AMC exams, there are two exams, the AMC MCQ and the clinical exam. The total cost can range from 8,000 to 10,000 Australian dollars. The duration, it typically takes 1.5 to 2 years to complete the process. Internship, a required supervised practice for 12 months. Scope, there's a high demand for doctors, especially in rural areas. Salary, general practitioners can earn between 65,000 to 150,000 Australian dollars, with higher earnings for specialists. This path is highly rewarding but requires significant preparation and commitment. Hope this video was helpful for you. Thank you for watching. Do subscribe to my YouTube channel for more medical-related content. Don't forget to like and share it with your friends. If you have any queries, let me know in the comments section or through my Telegram or Instagram page.